All right, we do want to bring in now Dr. Anahita Dua to talk more about the science here. Doctor, good to see you and a lot to parse through. Let's start with the COVID-19 shot being removed from the recommended vaccine schedule. So it is not banned, but the move does mean that access could be limited. Some pharmacies may choose to stock less or to not stock it at all. It also impacts the cost of the vaccine because if it's not on the schedule, insurers may not fully cover it. Do you agree with the committee's recommendation here?
I do not agree at all with the committee's recommendation, actually for two reasons. One, what you brought up, I mean, essentially every single time that a patient gets one of these injections, the discussion is held with the doctor anyway. So that's not something new. It's not like we're not talking to our patients about getting or not getting the COVID vaccine. But what's important is that we look to the CDC and we look to these advisory panels for guidance. What's going to happen in patients that do need the vaccine is they're going to say, well, I'm not really sure. No one's really telling me what I should be doing. It's not mandated, so I'm just going to let it go. And a lot of people who would otherwise have gone and got the shot are now not going to get it. So the confusion that has now been kind of instilled in our community is really problematic. So I really disagree because unfortunately, not only is it not scientifically valid, but it's also an issue that's going to cause confusion amongst our constituents.
Yeah, and cost Americans hundreds of dollars potentially for a shot if insurers no longer want to cover it. I want to play a clip of the former CDC chief medical officer's testimony on vaccines and get your response on the other side.
We know vaccines save lives, yet all 17 voting members of ACIP, the committee that sets vaccine recommendations, were replaced with critics. Flu campaigns were halted despite 270 pediatric flu deaths last season, the highest non-pandemic total ever, with 90% of those children being under or unvaccinated.
Do you agree with this? What is the cost of discouraging vaccination?
The cost is life. That's the cost. You know, I'll give you an example. Measles, for example, right? For measles to actually be something that our community is protected against, 95% of the people around you need to be vaccinated. That's what herd immunity is all about, 95%. So if it was raining, for example, you would need 95% of people to open their umbrellas for everyone not to get wet. But already in the United States, we have dropped to 90%, so we are already below herd immunity. And unfortunately, in certain pockets, we're down to 80%. So what does that mean? It means an explosion of these diseases and, unfortunately, children dying. And in the United States, there are two things that we don't like messed with. One are our kids, and the other thing is money. And unfortunately, RFK is doing that. And as a result, the polling numbers for him have dropped recently because of this type of thing.
I want to get your take as well. Just a few minutes ago, we heard President Trump speaking live at the ACI Founders Dinner, and he said there will be a major announcement coming on autism on Monday. RFK Jr. and the president have teased for weeks now that they will reveal the cause of autism. The president said tonight, quote, "I think we have the answer." What are your thoughts here?
Well, one, I think it's incredibly cruel to speak like that to the population, people who have children who are autistic or people who are autistic, to tease them exactly about what cause may be. But of course, the issue is that there's no way that in 2 months they've sorted out what the cause of autism is. You know, he discussed the idea that we're seeing so many more cases of autism, which we've already said is because we're diagnosing it more. And if you stop people on the street and say, can you define what autism is? You're going to get a variety of people talking about different things on the spectrum. So for them to say that they've discovered the cause for it is actually quite cruel and not what I expect of my elected officials.
Yeah, what are you expecting in terms of this announcement coming up on Monday and the likelihood that it will involve vaccination?
I'm expecting that that's exactly what it will involve, because thus far, this particular administration has been really forcing politics into places where science should be. Absolutely no one is saying that we shouldn't be looking at autism, that we shouldn't be studying autism, but we have to do it right. And unfortunately, if you're going to blame it on one thing, we could actually be missing out on what the actual cause of autism may be. And if we just say, oh, it's the vaccines, then it needs to be explained that why all these countries in the world that do vaccinate other Western countries that are very high numbers do not have the number of autism cases that the rest of the places have, even though they've got higher vaccination numbers. So I expect them to give an answer if they're going to do that, but also show the science. And I can tell you, as a scientist and a doctor, it is impossible that they have actually generated that data in the last 3 months.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.